Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your life. Today, let's talk about bloating and gas, and why probiotics may help some people when they are used carefully and realistically. Start with this question: what is bloating? Many people think bloating means there is simply too much gas inside the abdomen. Sometimes that is true, but often bloating is a mix of gas production, slow movement of gas through the intestines, sensitivity of the gut nerves, constipation, food fermentation, and the way the abdominal wall responds after meals. That is why two people can eat the same meal, produce a similar amount of gas, and only one person feels painfully swollen. Look at your pattern. Do you feel bloated after dairy, after wheat, after beans, onions, garlic, apples, sweeteners, or carbonated drinks? Do you feel it more when you are constipated? Do you burp more when you eat quickly, chew gum, drink through a straw, or smoke? Ask yourself, why is my gut reacting like this? That question matters because probiotics are not magic anti-gas pills. They are live microorganisms that may support gut function when the right strain is used for the right person. So, how can probiotics help? To understand that, picture the intestine as a living ecosystem. Your gut contains bacteria, fungi, viruses, and other microbes. Many of them help break down food, make small molecules that communicate with the immune system, support the gut lining, and influence how the bowel moves. When this ecosystem is disrupted, some people develop more fermentation, more irritation, looser stools, harder stools, or more gut sensitivity. Probiotics may help by adding specific helpful organisms, encouraging a healthier microbial balance, and changing the byproducts of fermentation. But pay attention to the word specific. A probiotic is not one single treatment. Lactobacillus is different from bifidobacterium. One strain inside the same species can behave differently from another strain. This is one reason the evidence feels complicated. Some clinical reviews show that probiotics can improve overall symptoms in irritable bowel syndrome, including bloating for some people. Other guidelines are more cautious because studies use different strains, different doses, different lengths of treatment, and different patient groups. So the honest message is this: probiotics may help, but they do not work for everyone, and the benefit is often moderate. Now ask, why would they reduce bloating and gas in the first place? First, probiotics may change fermentation. Gas is produced when gut microbes break down carbohydrates that were not fully digested earlier in the small intestine. This includes fibers, resistant starches, and certain sugars. That fermentation is not automatically bad. In fact, it can create short-chain fatty acids that support the colon. But if fermentation is excessive, poorly timed, or happening in a gut that is very sensitive, you may feel pressure, cramping, and visible distension. Some probiotics may shift the microbial community away from patterns that create more irritating fermentation products. Second, probiotics may support bowel movement. Gas feels worse when it sits still. If the colon is sluggish, gas and stool can build up together. That is why constipation often creates bloating, even when the person does not pass a large amount of gas. Some probiotic strains have been studied for stool consistency and bowel frequency. They may help some people move stool more regularly, especially when combined with hydration, soluble fiber, and movement. Do this before blaming every symptom on gas. Look at your bowel pattern. Are you going daily but still straining? Are your stools hard? Do you feel incomplete emptying? If yes, treating constipation may be the key. Third, probiotics may influence the gut barrier. The intestinal lining is not just a tube. It is an active barrier with immune cells, mucus, tight junctions, and nerve signaling. When the gut lining is irritated after infection, stress, dietary triggers, or inflammation, the nerves may become more reactive. Then normal amounts of gas feel abnormal. Some probiotics may support mucus production, compete with less helpful microbes, and influence local immune signaling. The goal is not to sterilize the gut. The goal is better balance. Fourth, probiotics may affect visceral sensitivity. That means how strongly the gut nerves report stretch, pressure, and movement. In irritable bowel syndrome, many patients do not necessarily make huge amounts of gas. They may feel gas more intensely. Why? The gut and brain communicate constantly through nerves, immune signals, hormones, and microbial metabolites. Some probiotic studies suggest effects on abdominal pain and global IBS symptoms, but results differ. So, if you have bloating with pain, urgency, diarrhea, or constipation, think beyond gas. Think gut-brain interaction, motility, diet, sleep, and stress physiology. Now, how should someone try probiotics in a practical way? Start with safety. If bloating is new, persistent, severe, or progressive, do not just take a supplement and ignore it. Get medical evaluation if you have weight loss without trying, blood in the stool, black stools, fever, repeated vomiting, trouble swallowing, anemia, a swollen abdomen that keeps worsening, severe abdominal pain, jaundice, symptoms waking you from sleep, or a strong family history of colon cancer, celiac disease, or inflammatory bowel disease. If bloating starts after age 50 or comes with a major change in bowel habits, get checked. If you are pregnant, immunocompromised, living with advanced chronic disease, have a central venous catheter, have a damaged heart valve, or are recovering from major illness, talk to a clinician before taking probiotics. Live microbes are usually well tolerated in healthy people, but natural does not always mean safe for everybody. Next, choose one product at a time. Do not start 5 gut supplements together. Why? Because if symptoms improve or worsen, you will not know what caused it. Pick a probiotic with the strain listed on the label, not just the species. Look for names like Lactobacillus rhamnosus GG, Bifidobacterium infantis, Bifidobacterium longum, or a defined multi-strain blend. The exact best choice depends on your symptom pattern and what has been studied. A product that only says proprietary probiotic blend without clear strain information is harder to judge. Do this. Take it consistently for 4 to 8 weeks unless you feel worse. Keep a simple symptom diary. Rate bloating from 0 to 10. Track gas, stool form, pain, meals, stress, menstrual timing if relevant, and medications. Ask yourself after several weeks, is my bloating less intense? Is it less frequent? Am I functioning better? If there is no clear benefit, stop. Do not keep paying for a supplement just because the bottle sounds scientific. Pay attention during the first week. Some people notice more gas when starting probiotics. That can happen because you are changing fermentation. Mild temporary gas may settle. But if bloating becomes severe, if pain increases, or if diarrhea becomes significant, stop and seek advice. Take antibiotics into account. If you are on antibiotics, ask your clinician or pharmacist how to time probiotics. Many people separate them by at least a few hours, but the right plan depends on the antibiotic, the reason you are taking it, your health status, and the probiotic strain. Do not use probiotics as a substitute for needed antibiotic treatment. Now let's connect probiotics with food. Fermented foods like yogurt with live cultures, kefir, kimchi, sauerkraut, miso, and some fermented vegetables can contain live microbes. They may fit well for some people, but look at the details. Yogurt may help one person and worsen another if lactose is a trigger. Kimchi and sauerkraut may be too salty for some people and too fermentable for others. Start small. Do not suddenly eat a large bowl of fermented food and then wonder why your abdomen feels full. Also remember prebiotics. Prebiotics are fibers that feed beneficial bacteria. They can be useful, but they can also cause gas, especially if increased too fast. Inulin, chicory root fiber, and some fiber bars can trigger bloating. If you use fiber, increase it slowly and drink enough fluid. Soluble fibers, like psyllium, may be better tolerated by many people than aggressively fermentable fibers. Here is a key point. Probiotics work better when the rest of the plan makes sense. If you swallow air all day, drink carbonated beverages, rush meals, and chew gum constantly, probiotics may not fix the burping and pressure. If you are constipated, address stool movement. If dairy triggers symptoms, test lactose reduction. If bloating is linked to high FODMAP foods, work with a dietitian if possible, especially before doing strict food restriction. If symptoms started after a stomach infection, mention that to your clinician. If bloating is severe after small meals with nausea and fullness, think about stomach emptying and get evaluated. Ask yourself, is this mainly upper bloating with burping or lower bloating with flatulence? Upper symptoms may relate to swallowed air, reflux, stomach emptying, or meal size. Lower symptoms often relate more to fermentation, constipation, IBS, and colon movement. This distinction helps you choose the next step. What about small intestinal bacterial overgrowth, often called SIBO? Some people with bloating, gas, diarrhea, constipation, or discomfort wonder about it. Probiotics are not always the answer there. In some patients, they may worsen symptoms. If your bloating is extreme, occurs soon after eating, comes with major bowel changes, or follows abdominal surgery, motility disorders, diabetes-related nerve problems, or repeated antibiotic exposure, speak with a gastroenterology clinician. Testing and treatment should be individualized. Let's keep expectations grounded. A probiotic that helps may reduce bloating severity, improve stool pattern, and make the gut feel calmer. It should not be presented as a cure. It should not be used to cover warning signs. It should not replace diagnosis when symptoms are persistent or severe. And it should not become a reason to ignore nutrition, movement, sleep, stress, and medication review. Look at medications too. Some medicines and supplements can contribute to bloating or bowel changes. Iron, calcium, opioid pain medicines, some diabetes medicines, some antacids, sugar alcohols in sugar-free products, and high-dose magnesium can affect the gut. If symptoms began after a medication change, ask your doctor or pharmacist before stopping anything. So, what is a sensible plan? Start with a 2-week observation. Track meals, stool, bloating, gas, pain, and triggers. Reduce obvious gas drivers, carbonated drinks, rapid eating, large late meals, chewing gum, and excessive sugar alcohols. Treat constipation if it is present. Then, if there are no red flags, consider a single probiotic trial for 4 to 8 weeks. Choose a product with clear strain labeling. Start with the recommended dose, or a lower dose for a few days if you are sensitive. Reassess honestly. Continue only if there is a meaningful improvement, and ask this final why question. Why might one person respond and another person not? Because bloating is not one disease. It is a symptom with many pathways. One person has lactose intolerance, another has constipation. Another has IBS with nerve sensitivity. Another has celiac disease. Another has pelvic floor dysfunction. Another has stress-related gut changes. A probiotic can help only if it influences the pathway driving that person's symptoms. That is the deeper way to think about probiotics, not as a trend, not as a cure, but as a targeted trial that may support the gut ecosystem in selected people. If you are dealing with bloating and gas, do not panic, but do pay attention. Look at patterns. Respect red flags. Use probiotics thoughtfully. Give your body a fair trial. Measure the response and stop what does not help. If symptoms persist, get professional evaluation because the best treatment depends on the cause. Take care of your gut with patience and common sense. I hope this helped you understand not just what probiotics are, but why and how they may help some people with bloating and gas. Stay safe, stay curious about your health, and I'll see you in the next topic.